Hello friends, welcome back to my channel Nursing Guru 24. Today we will discuss about an important topic from pediatric nursing, that is essential newborn care, that is ENC. As the name suggests, this is the important and very essential newborn care that should be done immediately after the birth. Essential newborn care is the basic care provided to every newborn immediately after the birth. Essential newborn care refers to it is the basic care provided to every newborn immediately after the birth, regardless of where they are born. Then the main goal of essential newborn care is to prevent infections, to maintain warmth by preventing hypothermia and establishing breastfeeding. The main goal of essential newborn care is to prevent infections, maintaining warmth and establishing breastfeeding. There are some 4 immediate steps that should be done immediately after the birth. The 4 immediate steps of essential newborn care are immediate drying the newborn baby, skin to skin contact, delayed cord clamping and initiation of breastfeeding. These 4 immediate steps should be done within first minute of life. That minute of life is called as golden minute. Golden minute of life. These all 4 steps should be done in first minute after birth. Which are those? Immediate drying, skin to skin contact, delayed cord clamping and initiation of breastfeeding. As we all know, immediately after the birth, on newborn baby skin there will be blood, there will be vernix caseosa, there will be amniotic fluid, right? As I told, amniotic fluid has a property of evaporation. When it evaporates, it will take body temperature along with it, that causes hypothermia. For preventing hypothermia, newborn baby should be immediately wiped and wrapped with 2 pre-warmed cloths to prevent hypothermia. The newborn baby should be immediately wiped with the help of pre-warmed cloth and it should be wrapped with pre-warmed cloth. No attempt should be made to remove the vernix caseosa because vernix caseosa prevents hypothermia. Use a clean dry cloth to dry the baby's head and body. This prevents heat loss. This prevents hypothermia. To prevent hypothermia, baby should be immediately dried. Then the second one is skin to skin contact. Place the baby on the mother's abdomen or chest. Place the baby on the mother's abdomen or chest. This provides natural warmth. This provides natural warmth and helps in developing bonding. Keep the baby on mother's abdomen or chest, that provides warmth and that creates bonding. That is called as kangaroo mother care, KMC. Then third point is delayed cord clamping. Wait for 1 to 3 minutes. Wait for 1 to 3 minutes before clamping and cutting the umbilical cord. This allows more blood flow from placenta to baby. Wait for at least 1 to 3 minutes because this allows more blood to flow from placenta to baby. That prevents anemia. That prevents anemia. If we cut the umbilical cord within this time period, sufficient amount of blood will not flow to baby, that may cause anemia. Then last one is initiation of breastfeeding. Start breastfeeding within the first hour of life. start the breastfeeding within the first hour of life, the first milk is very rich in antibodies and it acts as the baby's first vaccine. It gives protection against some infections. Comment me your answer. What the first milk of mother is called as? Right? These are the 4 immediate steps should be done within the first minute of life. Next we will see the 5 cleans. What are those? Clean hands, clean surface, clean blade for cutting the umbilical cord, then clean cord tie or thread, then clean cord stump. Why we should follow this? We should follow these 5 cleans to prevent neonatal sepsis and tetanus. To preventing neonatal sepsis and tetanus, we must follow the cleanliness during delivery. What are those? First one, clean hands. Proper hand washing should be done before handling the baby. Then clean surface. The place where we will keep the baby should be warm and it should be clean, and the delivery table also should be clean. Then for cutting the cord, for cutting the umbilical cord, we should use sterile blade to prevent against sepsis. Then clean cord tie or thread should be used. Then clean cord stump. Keep it dry. Do not apply any oils or powders over the stump. These are the 5 cleans we should maintain to prevent neonatal sepsis and tetanus. Next essential newborn care is thermoregulation. As I told, newborn babies are more prone for hypothermia. Our main goal is to prevent that hypothermia. Newborns lose heat very quickly because of larger body surface area to weight. Hence our goal is to prevent hypothermia. We should maintain the warm chain. Warm chain means the articles which are all comes in contact with newborn should be warm, like stethoscope, weighing scale and all. And the delivery room temperature. The delivery room should be warm and the temperature should be between 25 to 28 degrees Celsius to prevent hypothermia. Then postpone bathing. Do not bath the baby for at least 24 hours. Do not bath the baby at least for 24 hours. This prevents cold stress. Then head covering. Use a cap to prevent heat loss from the head. Use caps to prevent hypothermia from the head. This is how we can maintain the thermoregulation. First one, the warm chain. All the instruments which comes in contact with baby should be warm, including stethoscope, weighing scale, and as I told, the clothes which are used for wiping and wrapping the baby also should be warm. Then the room temperature, the delivery room temperature should be between 25 to 28 degrees Celsius. Then postpone bathing. Do not bath the baby for at least 24 hours. By this way we can prevent the cold stress. Then use caps for preventing hypothermia through or from head. Next essential care is giving routine medications and prophylaxis. First one in that, giving vitamin K injection. We, the nursing officers, are responsible for administering these all. That is vitamin K injection. 1 mg of vitamin K should be given intramuscularly. 1 mg vitamin K intramuscularly given to prevent hemorrhagic diseases of newborn, HDN. To prevent these disorders, we should give 1 mg of vitamin K intramuscularly. Then eye care. Eyes should be cleaned from inner canthus to outer canthus. using one swab at a time. Wipe or clean the eyes from inner canthus to outer canthus using one swab at a time, and instill some eye drops. They are erythromycin or tetracycline. Erythromycin or tetracycline instillations or drops or ointments to prevent ophthalmia neonatum. Ophthalmia neonatum. Then immunization. As per immunization schedule, that is administer BCG, OPV, then hepatitis B vaccine. As per immunization schedule, as per new revised immunization schedule, BCG, OPV 0 dose and hepatitis B should be given immediately after the birth. This is about routine medications and other prophylaxis. Vitamin K injection 1 mg intramuscularly for preventing hemorrhagic disease of newborn. Then eye care should be done using one swab at a time from inner canthus to outer canthus to prevent ophthalmia neonatum, that is the infection of eyes. We can use erythromycin or tetracycline ointments for that. Then immunization at birth includes BCG, OPV 0 dose and hepatitis B. Then next is very important, that is monitoring for danger signs. Watch for poor feeding, respiratory distress, fever or cold, jaundice and lethargy. Immediately inform the doctor if the baby is not taking the feeds or if the baby is not sucking the breasts, nipples. Inform immediately as soon as possible. Then respiratory distress. Watch for breathing, that is respiratory rate or breaths per minute. If it is more than 60 breaths per minute, immediately inform the doctor. Or if there is chest indrawing, if there is chest indrawing or the respiratory rate is more than 60 breaths per minute, immediately inform the doctor and watch for this. Then fever or cold. If the temperature is more than 37.5 degrees Celsius or if it is below 36.5 degrees Celsius, immediately inform the doctor and again watch for this. Then watch for another common condition, that is neonatal hyperbilirubinemia, that is jaundice. Sometimes there will be yellowish discoloration of palms and soles within the first 24 hours of life. If there is yellowing of palms and soles, inform the doctor and again watch for these conditions. Then lethargy. If there are very little movements or if there is very little activity, then look for this and inform the doctor if any. These are some danger signs we should monitor. For essential newborn care, here I have made an mnemonic, that is warmth, that is vibe. W stands for warmth, I stands for infection, breastfeeding and eye and cord care. If you can't remember the above things, at least remember this. Vibe, W stands for warm, that is prevention of hypothermia. Then infection control, I told you those 5 cleans we should follow them. Then breastfeeding as soon as possible, it should be within the first hour of life. Then eye and cord care. Hope you understood this. If you like this video, please share this with your friends, and if you are new to my channel, please subscribe my channel. Thank you. If you have any doubts, you can ask in comment section.